Now, in a special BBC report, we look at some of the world's rarest diseases.
Well, I first noticed it when I was about 6 years old. I remember standing in the school playground and all the kids were like laughing at me because of the way I was talking, and
then what
it was
happened
really
was,
difficult, you know.
Then I
got teased a lot.
Daniel suffers from Anderson syndrome, a rare and traumatic speech disorder which affects only 1 in 2 million people.
Yeah, I do.
Daniel's condition means he constantly talks over himself, something that he finds hard to deal with.
Well, it is embarrassing sometimes, but I have to live with it. But part of me doesn't accept it, and it finds it very Anderson syndrome. I find it very difficult for the rest of my life. I accept that, because it's very hard.
But Anderson syndrome is just one of the many uncommon conditions that the world's medical experts are struggling with. Accentia nervosa is a debilitating mental disorder in which a victim's ability to sustain a convincing accent deteriorates rapidly. We spoke to Dr. Alfred Scheiser from the University of Munich, who has contracted the disease himself.
I've been working closely with the patients, and we have found that this disease can spread very quickly. We must act soon because this condition could become a global epidemic within 10 years. If you suspect your child is infected, if you notice a change in that accent, have them tested immediately.
Unfortunately, some victims never regain their proper accent, forcing many of them to seek new lives in places where their offensive intonations will be tolerated, such as New Zealand or, in extreme cases, South Africa. But there is good news. Dr. Scheiser says there are ways of preventing accentia.
We are warning people to stay clear of SBS TV in the mornings, as exposure to multi-language news broadcasts could be a risk factor. Also, try to avoid the Lakemba area, mate.
But while some researchers focus on these unusual disorders, others are turning their attention to more well-known but equally baffling ones, such as Parkinson's disease. Bob has Parkinson's disease and lives with his wife, Margaret.
Can you pass me the tea, dear?
Yes, dear. Do you want some more milk in it?
Thank you, dear.
It's such a beautiful day outside.
Yes, they expect to rain this afternoon. Now, you had an interesting childhood, didn't you? Tell us about your father. He was a very religious man, wasn't he?
Bob believes he is talk show host Michael Parkinson.
In your latest film, you star alongside Richard Gere as an unemployed actor. Was one of your most difficult roles, wasn't it, I suppose?
Doctors expect Bob doesn't have much longer to live, possibly only long enough for him to interview Rolf Harris for the 5th time.
It's so hard sometimes to see him like this, when he gets like this.
So, just a slight delay then as we...
After the break, we look at another rare disease which causes the sufferer to stand way too close to the microphone.
Hello, my name's Jason. I suffer from Fearon syndrome.
That's next on BBC Health.